Hey, hi everyone, thanks for joining. We're just waiting for our expert to join in.
Hi Nisha, how are you?
I'm good, how are you doing?
I'm good.
So, I hope my video and my voice is all clear to you.
Yeah, absolutely clear. Thank
Right.
you so much, first of all, for inviting me to talk about a very important topic which is very less discussed about. It is just discussed behind closed doors.
Yeah.
People don't want to talk openly about it. So I'm
Exactly.
looking forward to a great interaction.
Pleasure is all mine, Aditi. Before we begin this show, let me introduce you to the crowd, to our mommies and everyone. So, mommies, today, after so many shows and after getting so many feedback from you all, we all thought at Nutrizoe that there is something that we really need to now talk about, which, as Dr. Aditi said, is a very less spoken topic. People do not want to talk about that topic in open. They discuss, they feel, they go through that emotional ups and downs, but all behind the doors. So today,
Correct.
Aditi. She is a gynecologist. She is an IVF expert. She is a fertility expert. She who holds an experience of good 11 years. And generally, her mothers call her a pillar of support when it comes to difficult pregnancies, when it comes to difficult trimester situations, when it comes to miscarriages. So today, we are here to discuss miscarriage and pregnancy with her. So going ahead, Aditi, I would really like you to discuss and to tell that how commonly miscarriages happen. Because you meet
Yes,
so many mothers nowadays. How
correct.
common miscarriage begin?
See, miscarriage as such, it completely depends upon the mother's age. But in general, the incidence ranges around 10 to 15%. But as age increases, say women above 35 years of age, it may go up to 20%. Above 40 years of age, it can even go to 40 to 50%.
Hmm.
Because in such cases, the chances of genetically abnormal fetus increases. So obviously the chances of miscarriages go high. बट व्हेन इट अकर्स इन अ फैमिली ना तो उनका क्या रहता है कि हाँ हमारे फैमिली में तो कभी पहले हुआ नहीं है फॉर देम इट्स अ वेरी वेरी बिग थिंग there is some problem why it happened with us. It has not happened with any of the women in our family so far. So for them, the incidence, it is very important to make them understand that 10 to 15% of normal pregnancy in a miscarriage. It is like a rescue phenomena that nature plays a role in it, that if the pregnancy is not healthy, it won't allow it to grow further.
Okay.
Okay, if there is some genetic abnormality in the fetus, that fetus will it will naturally get aborted and it will not progress further.
Right. But as I did a little study about miscarriages and the situations that happen, there are different kinds of miscarriages like inevitable, incomplete, complete miscarriage, missed miscarriages, mid trimester miscarriages. So, what
Very
are
right.
the
Yeah.
difference in all of them?
Now, when it is inevitable, it means that the bleeding has started occurring. Okay. Whenever during early pregnancy, the patient has started bleeding and the abortion process is about to happen, and now it is we have lost the time. It's a situation which has gone out of our hand and it is going to end up in a miscarriage. It is like no saving situation. So we
Mhm.
cannot save that pregnancy. That is inevitable abortion that is going to lead to an abortion. Missed abortion is patient doesn't having any signs. She doesn't have any bleeding. She doesn't have any pain in abdomen. She has come for a routine check and we see that the baby's heartbeat has disappeared suddenly.
Mhm.
And we have not come to know. So it is called as missed abortion. When
Right.
it when it comes to incomplete abortion, that the process has already occurred, but still there are retained products still inside the womb. So the entire products of conception has not completely come out. It has not got aborted. So that's
Mm.
why it is called as an incomplete abortion.
Okay.
Complete abortion is already when a patient is saying that she is having bleeding since a while, and when we do a scan, we don't see any pregnancy sac. We don't even see any retained products of conception. In that case, nothing is to be done because the entire products of conception, entire thing has been aborted naturally, and there is nothing inside left. So nothing has to be done further. Mid-trimester abortion is something which occurs after 14 weeks of pregnancy, wherein the chances of genetic abnormality are a little bit less, but more can occur because of some infection which the mother has acquired during pregnancy, or there is cervical incompetence. Now, cervical incompetence is something that if you have a uterus, the mouth of the uterus is called the cervix. Now, the minimum length which is required, which is a good length, is around 2.5 centimeters. Okay. Now, in certain patients, a patient may go in labor. She doesn't even come to know because she doesn't have any pain or anything. Suddenly, she'll start having pain, and when she comes, she's already, fully dilated, about to deliver, which is called a second trimester abortions, where we didn't even realize that the cervix, she has gone in silent labor. She doesn't have any pain. She just comes, and then suddenly she has pain, and in probably half an hour she aborts. Okay. Or the cervical length completely shortens. So when we do a 3 weekly scan, after NT scan is done at 12 weeks, which is a very good time where we can pick up by a method as elastography, sonography procedure, where we can pick up a screening test to find out that, yeah, this patient has a high chance of going into a preterm labor and a cervical incompetence, which we can prevent by putting in a stitch at that time to prevent an abortion to happen. That is called as a mid-trimester abortion, where it occurs after 14 weeks of pregnancy.
So, as you twice mentioned about the genetic defects, right? So, what are genetic effects that causes miscarriages?
See, genetic defects can be trisomies, monosomies. These are all the terms wherein there may be extra pair of chromosome. Okay. Now, any fetus has 2 pairs of chromosome, one coming from each, the mother and the father. So there are 23 pairs of chromosome. Now, there can be an extra chromosome in any of those chromosome, that 23 pairs, or there can be deletion. There can be a single chromosome instead of 2 chromosomes, which is called as monosomy, or there's any trisomy when there is an extra pair of chromosome. There can be chromosomal deletions or additions. These are all genetic terminology which can see this, especially monosomies are the most common cause of miscarriages because those pregnancy don't progress. Whereas the most common ones which you have heard is like a trisomy 21, that is Down syndrome, wherein the pregnancy survives, the baby grows well, everything is, the growth of the baby goes fine, but you will detect an anomaly at around say 12 weeks on an NT scan or something called as a double marker test, which is we do as a screening test to rule out any genetic abnormality. So these are the common ones which can lead to an abortion.
Okay. So, Aditi, help me understand this one thing, because I also mentioned at the beginning that you are an IVF and a fertility doctor. So, this is a common thought among many of the women that continuous or recurrent miscarriages, not one, maybe twice or thrice. Is it infertility?
No, it is not related to infertility. Infertility means that our couple is having this difficulty in conception. So pregnancy only doesn't occur at the first place. What is the definition of infertility? When a couple is trying to having unprotected relation for a period of 1 year and still not able to conceive. That is called as an infertility. But yes, definitely they are mainly treated by infertility doctors because obviously they have difficulty in conception. Some of them have conceived through IVF and then which has caused abortion, or IUI which has caused an abortion. So first of all, they may be having simultaneous some other factors which is making it difficult for them to conceive, and once they conceive, it ends up in a miscarriage. So obviously we do get such patients wherein it's just not that they're able to conceive naturally and they are aborting, but they may have been having some other infertility issues as well. Okay. But it is very important to do a proper comprehensive workup for the mother as well as the father. Suppose when the cause is genetic, a person, you are the first time patients coming to you with difficulty in conceiving, that I've had 2 abortions, still why I'm not able to conceive. And then what happens once the patient aborts? They want to conceive immediately. They have this thing, that time will go. So they come and approach us that, we want to conceive immediately. We don't want to waste any more time. So आप IVF कर लो. So it's every patient doesn't require IVF. We first need to rule out the cause which has led to an abortion.
Right.
Now there are various causes of abortion. It could be genetic, like we already discussed. It could be some uterine anomaly which the patient is having, like a septum inside the uterus or fibroids or a polyp, which the pregnancy has implanted, but it's coming in the way and it doesn't let the pregnancy to grow, which can lead to an abortion, which can be easily detected on a sonography.
Right.
Or it could be some infection, which is rare, but it can happen, that some infection which has lead to an abortion, which has the patient has acquired during the pregnancy. Or like I said, like trimester abortion, like a cervical incompetence, which can lead to an abortion. Or some autoimmune factors. That is also very common. You must have heard patient having psoriasis, SLE, or any autoimmune condition where the antithyroid antibody levels are very high. Something called an APLA syndrome, wherein your body is producing antibodies against normal cells present in your body. So when a pregnancy occurs, like I said, half of the genes are from the father. During pregnancy, something called as blocking antibodies produced, okay, which tells your body that this pregnancy is not foreign. It is part of your body. So the pregnancy is not rejected. But in patients having autoimmune conditions, these blocking antibodies are not produced. And there are antibodies produced against the pregnancy, which rejects the pregnancy and leads to a miscarriage.
Okay.
So that woke up, and that can be easily preventable with certain medications. As soon as the pregnancy is detected, we start on certain steroids, low molecular weight heparin injections, aspirin, which can at least prevent an abortion by say 70 to 80%. So how much ever is there in our hands, we can definitely try to salvage the pregnancy.
So Aditi, there are different situations which lead you to abortion. So help us understand, are there different symptoms? So, or like someone bleeds, someone has something else. How do a mother or a woman understand that she is at a place where she needs to get an abortion done? So what should the first action advise before reaching a doctor?
So whenever during a pregnancy, once you know you are already pregnant, first of all, once you have missed your periods, get a urine pregnancy test done immediately. Go and show to a gynec. This is a misconception कि हाँ अभी तो pregnancy test positive आया है, मैं 3 हफ्ते के बाद जाऊंगी gynec के, but it's not required right now. There's no checkup required, so that should not happen, because it is the first scan we can come to know whether the pregnancy is growing slowly or whether there is any problem in the pregnancy. So as soon as you know that you have missed your periods, do a urine pregnancy test. If it comes positive, go and show to your gynecologist. Any bleeding during pregnancy need not be ignored. It has to be seen. It may be just a spotting, but don't ignore it. Because if you reach your doctor early, we may be able to save that pregnancy. If you are going through an abortion, it may lead to an abortion. So a stitch in time saves 9, it is very rightly said. So any kind of spotting, any bleeding, show to a gynecologist. Don't wait कि हाँ I will observe, let me see वापस होता है, then I will go and show to the doctor. No, if there's even one episode, you go and show to your doctor. There's no harm in showing to a doctor. Any pain in abdomen, you may get mild cramps in the lower abdomen, which could be related to, which is an early sign of an abortion. Any or severe pain in the abdomen. So these are all basic signs. Some such symptoms or any signs which you have, you should go and show to your gynecologist. Some patients may not have any signs. It's just on general checkup. So whatever your gynecologist advice after your first checkup, please go for regular follow-up, because in such cases, some patients say कि हमारे जमाने में तो सोनोग्राफी सिर्फ 3 बार होती थी पूरे प्रेगनेंसी में. Why are you doing so many checkups? But these are the early stages of pregnancy that Zamana jo bolte the, it was different. People were conceiving at the age of 20. Now we get women at the age of 40, 45, where the risk of abortion rises drastically. So we need to closely monitor the pregnancy, especially during the first trimester. Because here is a time where the progesterone levels may not be adequate. You may be having some associated autoimmune factor which you are not aware about, which may lead to an early abortion, which all can be prevented by just good supervision and good follow-up with your doctor.
Right, right. So, as I already mentioned, this is something very sensitive when it comes to emotional level for a mother. So, Aditi, help us understand what are the emotional effects that a woman face post miscarriage and how suggest them to deal with that.
Correct. See, it is very easy to give. Obviously, we tender loving care is the all what we can offer. Offer once the abortion occurs, but it is very difficult situation for the patient who is going through, because that kind of emotion only a person who goes through it can understand, because that baby has never arrived, but that they will never leave their heart. That memory, whatever few weeks of happiness that
Right.
pregnancy has given them, that never leaves your memory. So it is very difficult for them to overcome that situation. But I always tell, so your support of the husband, the support of the family is the most important thing. And that's what I believe, that you should obviously, tender loving care is all that you can offer them in this such situation, wherein you can make them understand that such situation, give them the facts. Obviously at that time the facts doesn't make sense to them, but you need to understand, if you're able to find out some cause, we can make them understand that this is something which cannot, it won't be recurrent, because the fear is, will I be able to get pregnant ever again, will I
Mhm.
be able to have a baby. So first of all, remove that fear from their mind. And anytime you should not, if a patient is going, you should never deny counseling. Always see counseling. There's no, nobody has to be feeling shy or ashamed about. If a counseling is required, mental health is the most important thing before you try conceiving again. It's only when you are mentally healthy then you'll be able to get your pregnancy well.
Right. And also, like emotionally, आपने बता दिया that we should go for a counseling, husband support, family support is very important. Do we need a medical treatment also after miscarriage? Something after miscarriage, that is
Of
after the
course.
over, after a month or something like that.
First of all, we need to rule out what was the cause of the miscarriage. So
Okay.
sometimes when a patient comes to, when we already know she is having missed abortion, what we can do is, when we do a DNC, when we, under anesthesia, we remove the retained products of conception, we can send those products for genetic testing, and we can rule out whether there is any associated genetic cause which led to this abortion. And one, in the non-pregnant state, so certain blood tests are done to rule out any autoimmune factor which has led to this abortion.
Mm-hmm.
Some patients already have a history of multiple abortions. What they can undergo, they can go couple karyotyping, where this is a blood test, wherein they do the entire genetic testing of the mother and the father, and they rule out whether there is any gene defect which is resulting in multiple abortions. And fourthly, now with the advance of IVF, there are couples who have repeated history of abortions because of some genetic defect. What we can do is, through IVF, we can make the embryos, and we can first do a genetic testing of the embryos and only transfer those embryos. And especially when we know the particular gene defect which has led to a multiple abortion, we can particularly test for those diseases and only transfer those embryo which are euploid. Euploid meaning there is no genetic abnormality in the baby. So obviously we rule out that genetic cause that which led to abortion. If a patient is having mid-trimester abortion, wherein the abortion has happened because of cervical incompetence, we can do a procedure called as laparoscopic interval cerclage, meaning that in the non-pregnant state, laparoscopically, we put in a tape near the opening of the cervix. Okay? So once the patient is pregnant, even because of that tape, it will keep the cervix in whole, and it will prevent the patient in going in premature preterm labor. It will prevent the cervical shortening. So obviously, it will prevent abortion because of cervical shortening. So these are the ways. And yeah, if there is on sonography, if we detect some septum जो पर्दे जैसा होता है गर्भाशय के मुख के अंदर, or if there are multiple fibroids which has led to an abortion, or there is a polyp, or there is some other anatomic defect of the uterus which can be corrected by hysteroscopy and with the help of laparoscopy. So we correct that first and then we ask the patient to go ahead with pregnancy planning. So all of that is corrected. At least we have ruled out whatever is in our hands.
Right, right, right. So, Aditi, like we all know, when women become pregnant, right, everything within us changes.
Correct.
So, all our organs, our body shape, everything has the effect of that 9 months pregnancy.
Absolutely.
But what happened to a woman's body during miscarriage? This is something which I really wanted you to specifically, because as you mentioned, we cover this topic. People don't
Correct.
come and discuss this thing in open. They just want to hide if the miscarriages happen. They don't want to come openly discuss. So, what are the things that body goes through?
So it is mainly, obviously, a pregnancy causes a lot of hormonal changes in the body. Especially the first trimester is very bad when there's a lot of nausea. So patient's appetite goes for a toss. They are not able to eat well. There's a lot of nausea. And plus, when this happens, there's a lot of emotional turmoil. And that situation is so taxing. We all know because of stress, because of when you are depressed, the emotional quotient is low. You are going to tend to gain weight. Okay, you are not mentally prepared. Obviously, you have to go. Some may have to go that excesses of bleeding. It's very difficult when you pass that fleshy mass to see that the pregnancy going in front of you. So definitely it affects your body both physically and mentally. And but it is nothing like they have this fear that abortion has happened. It has probably damaged my uterus, or I will never be able to get pregnant again. So that is not the issue. Any pregnancy, if even an abortion happens, it doesn't affect the uterus as such. The uterus is healthy. We need to first rule out the cause of pregnancy, and patients can easily conceive once obviously the cause is ruled out. They can try for another pregnancy, say in a period of 2 to 3 months, without taking a longer break.
So also, as we all know, जैसे आपने बोला अभी that कई बार after miscarriages mothers को ऐसा लगता है that let's just conceive immediately, the time window will go या हम ले.
Correct.
So is the pregnancy after a miscarriage, immediately after a miscarriage, is it high risk? How much time gap should we look for?
So, like I said, any 2 to 3 months of time is a good enough time where we can do a proper workup. What was the reason of the miscarriage? And in those 2 3 months, we even ask the patient, adopt a good, healthy form of diet, exercise, meditate to just get a good frame of mind to conceive again. And whatever things which we can correct, we correct in those 2 to 3 months' time and rule out what was the cause of miscarriage and work towards it. So I think a 2 months to 3 months time is good enough after miscarriage has happened. Until and unless a patient has undergone some surgery like a big fibroid or something. But in that case also maximum 3 months, not more than that. Is required. A break is not required that long.
But what if a mother just conceives just after miscarriage, maybe a month?
Yeah.
So is there any
So even if a pregnancy occurs, see, every pregnancy is different. So it was if it was just a one-time cause which led to an abortion where we everything is normal. There was no genetic abnormality. She doesn't have any autoimmune disease. Her uterus is absolutely normal. It was just a one-time thing which happened. Like I said, every 10 to 15% of normal pregnancies end up in a miscarriage. So if it's a one-time thing and she has again conceived, it will grow absolutely normal if the pregnancy is healthy. If she's having any associated problem like a genetic problem or an autoimmune disease, then obviously we'll have to support the pregnancy for any autoimmune condition which can lead to miscarriage. And if it is a genetic thing and we have not got a chance to evaluate the genetic basis, what we can do is, as early as we can do a non-invasive testing, which is a blood collection wherein we can rule out any genetic abnormality in the baby. We do an NT scan and we can go for a double marker test at 12 weeks. And if they're showing some high risk, then we can go for invasive testing like an amniocentesis at around 15-16 weeks of pregnancy.
Right.
But it won't change completely. It's not like that it's very, very high risk until and unless obviously there's some autoimmune condition involved which lead to an abortion, in which case we need to give a good pregnancy support. And like I said, a close follow-up for the, and obviously even the patients, they are very scared that it should not happen again. So they have 10,000 questions that whether even this pregnancy will lead to an abortion. So obviously, if we know the cause, we'll be able to counsel them much better.
Right. So as you just mentioned that they should be having a good diet, rest, stress free. So also help us understand just like this is what people normally follow. Once they have the miscarriage, they always say the first 40 days is very important for a woman body. They should rest, they should give.
Correct.
So your views about it.
See, rest, I would not suggest bed rest because at least they can start some form of physical activity slowly. They can meditate, they can do yoga, a good healthy diet, which, just a holistic approach wherein, patient's mental health as well as physical health gets improved to carry on a pregnancy. Some patients are not really in a hurry. They want to take a good 5 to 6 months break. So accordingly, see, every patient is different. Every cause is different. The age of the patient matters. The ovarian reserve of the patient matters. How long a patient can wait matters. Sometimes even obesity can lead to a miscarriage. So a patient
Okay.
having a very high BMI, that is also a very common cause of a miscarriage, which is very abundantly increasing in Indian scenario now. So diabetes, thyroid, all of that is not worked up in initial pregnancy time. Many a times because they don't consult a gynae. So that is also a very important point to stress. And as soon as you get pregnant, get your thyroid, even before planning a pregnancy, get your basic levels, your sugars tested, your thyroid levels tested, because any abnormality in thyroid levels and sugars level, high risk of abortions and diabetics. And now
Mm-hmm.
India is the diabetic capital of the world, and young patients are getting diabetes. PCOS patients, again, they have high risk of diabetes during pregnancy, thyroid abnormalities, which can lead to an abortion. So it's just not the age, it's your lifestyle, it's your BMI. If you have any associated disorders previously, first correct all those disorders and then get pregnant. And as soon as you get pregnant, get yourself all those levels tested to know that everything is normal. And if there is some abnormality, we need to correct it, because so many times a patient, when they come and we do a routine checkup, we come to know thyroid is 6, thyroid is 8. That can lead to an abortion. Very high. Some of them
Right,
even
right.
require high insulin doses in pregnancy. And they're
Mm,
shocked because they're just 20 or 29 and they've got diabetes. They've never
right,
realized because they've never tested themselves. Because it's the lifestyle. So lifestyle modification along with a holistic approach, like I said, both physical and mental health is important before you conceive.
also, Aditi, as you are a IVF doctor, and we also did so many shows where we have discussed about IVF and we have discussed fertility issues with the mothers, and where doctors have suggested that if suppose you want to have a baby, please start planning 3 months or 4 months before, where they have
Correct.
a big stress on the multivitamins, folic acids, and these boosters. Is
Hmm.
for who has gone through a miscarriage and wants to conceive again, do you also recommend for them that they should go for a planning, like a multivitamin course or a proper nutrient course before they conceive again?
See, what we advise is preconceptionally, we say 2 to 3 months of folic acid is required to prevent any neurological defects in the baby. Secondly, if vitamin D, if you all have not taken the supplements, which I'm sure now because of COVID, everybody is taking too much of supplements. हमको जरूरत नहीं पड़ती है बताने के लिए. So I think the Indian population as such, they do take. So folic acid, vitamin D, which we advise once a week for 8 weeks if you all have not taken in last 3 to 4 months, because even vitamin D, low vitamin D plays a very important role in infertility.
Okay.
So that is to be given. And obviously, if the hemoglobin is low, which is also common in the Indian scenario, first correct your hemoglobin before, because you can take iron supplements if required.
Right, right.
So that's it. only folic acid, and obviously for those who have history of any autoimmune disease, as soon as the pregnancy is detected, that means as soon as the urine pregnancy test comes positive, after assessing them, we do start on aspirin, low molecular weight heparin, low dose of steroid in certain patients wherein, certain autoimmune factors like APLA is positive or ANA is positive. These are all autoimmune blood tests, which can cause an abortion. So for such patients, this medicines have been started, and obviously progesterone and everything, but that will be started once your urine pregnancy test is positive,
Okay.
not before that.
Right. So also, Aditi, there was this.
Ovarian reserve is less. Sorry to interrupt you. If the ovarian reserve is less, we
Uh,
always do. The woman is of any age more than 30 years of age. Even though conceived naturally and for abortion हुआ we always get an AMH done. So if the AMH is low, we also give certain adjuvants, antioxidants to improve the egg quality. There's no medicine to increase the egg count or the ovarian reserve drastically, but it definitely improves the egg quality, which helps in conception.
right. So medically, there are many things around which can support a woman and to come out of that one miscarriage and again go for a very healthy pregnancy in a very happy manner. Right. So Aditi, there was one thing was very which I read when I was reading about this topic, that there are some times where a woman have seen symptoms of miscarriage, but still,
Hmm.
how's this possible?
But still they haven't got pregnant.
Yeah.
Okay. So what is something called as biochemical pregnancy?
Okay.
So they have missed a period. They have done the urine pregnancy test. See, a pregnancy is not detected on sonography before 5 weeks. So
Right.
as soon as one misses period, so that's about 4 weeks. So that is detected. The HCG level, which is secreted by the healthy pregnancy, it is detected in the urine. So that is the urine pregnancy test, which is done, and by blood, wherein the beta HCG levels of the blood are measured, which tells us whether that levels are corresponding to the weeks of gestation.
Right.
Now, in such patients, when they do a pregnancy test that comes positive, after a week, say after 5 weeks, when they go for a checkup, when they do a sonography, there is no sac seen on the sonography, there is no fetus seen.
Hmm.
That means the pregnancy has occurred, but it has not grown further, it has not progressed further, and it has led to an abortion, which is called as a biochemical pregnancy. Most common cause of biochemical pregnancy again is a genetic abnormality. So it is a nature's way of a rescue phenomena where it doesn't allow abnormal pregnancy to grow further. Some
Mhm.
women really don't even realize that they have undergone a biochemical pregnancy, because sometimes they may wait for 2 weeks if the periods are delayed. They may not immediately do a pregnancy test. So they delay it after 2 weeks. They get the periods. Actually, it's not the periods. They must have conceived. That's why the periods got missed and they got delayed. But they've never tested, and probably वो biochemical pregnancy हो भी गया and they have not realized it.
Right.
When patients seeking fertility treatment like IUI, IVF, wherein after the procedure, irrespective of the 14 days, we do a urine pregnancy test. So in
Okay.
which it is detected early
Okay.
that okay, there is a pregnancy which has occurred,
Hmm.
and when we do a sonography, the pregnancy has not grown. We even do a blood beta HCG levels, but the HCG levels are very very low, say less than 50, less than 100, and after 48 hours they don't double. Usually after 48 hours the beta HCG levels double up, which
Okay.
they don't double up. That means the pregnancy is not growing well.
Okay.
Sometimes after an IVF and after an IUI also, patients are given HCG injections for support. Now that HCG has a half-life of 5 days.
Okay.
Sometimes patients are very eager, वो अपने आप ही जल्दी कर लेते हैं pregnancy test. They cannot wait for those 2 weeks. And then the message that this is positive. But ideally it is that HCG injection which has been given. And that's why the urine pregnancy test is coming positive. And probably if the pregnancy has not occurred, so then you don't see अपने आप after a week the HCG test comes negative. Or on sonography we don't see a pregnancy.
Oh.
So always do it after 14 days, and if an HCG injection has been taken, then do the test after 5 days of the injection. Don't do it early, otherwise it will come falsely positive.
Right. So there were many questions that we got from mothers, Aditi. There was one of this that they are asking how to prepare your body post miscarriage for the next pregnancy?
Okay. So like I said before as well, a good nutrition, healthy diet, and always keep a positive attitude, because any kind of stress will affect your chances of getting pregnant.
Right.
So you have to go with a very positive approach. Keep your emotional baggage behind. Whatever's happened has happened. You have to start from scratch. It was a roadblock which we have crossed now. And obviously, with your discussion with your gynecologist, that what is the further plan of management, when you can plan the pregnancy, whether they can plan it naturally or IUI or IVF is required, all of that discussion, and then with a healthy approach. And like I said, your partner support plays a very big role, because it is not the woman's mistake. Okay, every time the woman is blamed for everything. It is not really their mistake, and at the end, they only have to undergo that emotional turmoil as well of going through the abortion process physically and mentally. And I must say that it's not like that in our society as a hota hai, but I've seen a very good response from the husbands as well, which makes me very happy. They understand. They say, I don't want her to undergo this again and again. So first, we are not in a hurry to get pregnant. First, let's find out what was the problem which led to an abortion. Let's solve that, and then only we'll plan the pregnancy. So obviously that scenario is changing, and I should mention that as well. So it's not like that previously. There are both types of couples which we have seen, and that support is really which is required for a mother who, I mean, for a woman who's trying to get pregnant.
So, as you just mentioned about the partner being supportive and being so careful, the next question that is really a very beautiful question. It's saying, do men once a
Of
miscarriage?
course, of course, I've seen husbands crying in the OPD. Sometimes women are strong. I've seen them shedding tears, and obviously it's a very, very difficult. Obviously, men also do have emotions. Obviously, they don't express that commonly, and they are not undergoing through. But obviously, they are also going through a very emotionally bad phase in their life. And like I said, that if counseling is required, one should go for it, because there are patients who are taking anti-anxiety, antidepressant medicines because we're trying to conceive. Not only abortions, infertility is such a high rise where they're married since 10 years, 15 years. Some of them are not that financially good. So obviously it is very, very bad situation, and our society is such that if there is no baby, it's a big thing. Okay, though so many years of marriage, still there is no baby. So men also equally undergo through that pressure. There are certain fertility factors where it affects the men as well, where the count is zero or they cannot conceive with their own sperm, where they have to go for a donor sperm. So obviously men also undergo through a lot of emotional stress during such situations.
So, the next question coming up is, I had my abortion 3 months back. How much time my body will take to heal?
2 to 3 months, she can start planning right away if everything else is ruled out.
Okay. The next one coming is there anything to be careful about if you conceive again very soon?
Like I said, visit your gynecologist right away as soon as you conceive. If there is any autoimmune factor, he or she may put you on certain medications to support the pregnancy. And do a basic blood levels to rule out if there is any thyroid, any sugar abnormality, and get them corrected.
The next one coming is, can stress cause miscarriage?
Not really. Stress as such don't cause miscarriage. So some of the patients are like, I'm too much into work. I have so much of work. Husband's complaining she's not taking rest. That's why probably she started bleeding. So stress directly doesn't cause miscarriage as such. But yeah, if you it does help. It does definitely decreases the chance of conception. So any stress, it releases steroids in that stress hormones in your body can affect conception. Directly, it doesn't affect pregnancy as such. So no direct connection.
No direct connection between that. Okay. A very common question coming up is, will I miscarry again? This is the biggest fear in.
Of course. Like I said, it's like mathematics. You solve the problem and you will achieve a solution to it. So we have had patients with 5 abortions, 6 abortions, and as soon as they get pregnant, one of our patients very recently she had 5 abortions, and she conceived naturally. And then she said, "I'm not leaving your hospital. I'll be here till 20 weeks. You check my baby every day." So that is the fear. So you have to make them understand that the pregnancy is growing well. It may not happen this time again. We have made sure. Again, when it comes to autoimmune disease, it's 90% is in our hands. 10% is then destiny and fate. So we are not gods. We'll do whatever ever to salvage the pregnancy, give whatever support which is possible. But still, in that case, also, if there's some autoimmune disease or if the baby is genetically abnormal, miscarriage still can happen. But if there was some correctable defect, like a uterus having a septum or fibrous, if that is corrected, then obviously the chance of miscarriage decreases drastically. And even during pregnancy, when we do genetic testing of the by NIPT or double marker screening, what we do, if everything is normal, the chances of miscarriage again decreases drastically. For mid-trimester abortions, like I said, we can do an interval circlage laparoscopically, wherein we put in a tape to prevent an abortion. Or during when she's already pregnant and she has not gone an interval circlage, as soon as the NT-scan, that is a scan done at 12 weeks to rule out any genetic abnormality of the baby. Everything is normal, put in a stitch which is called as cervical circlage, os tightening, which is a planned os tightening, wherein we put in a stitch to prevent preterm labor, which can prevent. So obviously we have to be extra careful. 90% we can, avoid an abortion. 10% then we have to live it to our fate.
Right. So I think there's one person who's asking, if a patient out of India, how can they get your treatments? Is there any platform where they can you?
Do a lot of online consultations. We have because see, I have many patients from US, UK, where help is not very easily available. Many pregnant patients as well, because until unless there's an emergency, they don't like how we do WhatsApp every 2 minutes. Can I shampoo? Can I use a shampoo? Can I color my hair? So, it's a constant WhatsApp which goes on, which I really like because it helps me connect with my patients. And I would say if I'm in that situation, even I would have 10,000 questions. So that is not the scenario when patients are based abroad. So we have many, many patients who do online consultation. Again, in continuation with the whatever follow-ups are going on there. See, in online consultation as a gynec, there's a big, it's not like a doormat or something where we see your face and we can say, okay, you have this problem. Right. Without checking you clinically, we won't be able to, treat you that well. But obviously, there are certain things like when you share your reports or some problems, we can advise you medication. So definitely, online consultation, we are always available. You can contact us on our Instagram handle or on our Google page, wherein all the details are available.
Right. So Aditi, as we are on the end of our show, I would love to have some positive mantra which you always share with your mothers once they in a broken state.
Correct. So I always tell them that despite this disappointment, of be it a biochemical pregnancy or be it a abortion or incomplete abortion or whatever it is, the fact that the embryo has implanted and it has progressed for a few weeks, there is some hope left. So never give up on that hope. There are patients who are not able to conceive. Itna bhi nahi hota hai. They don't even reach this stage. Right. They've never seen those 2 pink lines ever in their life. So at least you got to experience that. So take the positive out of it. Leave the negative behind. Let's start a new chapter. And definitely we'll reach our destination. So obviously, we give 100%, 1,000% efforts to prevent a pregnancy. Then we have to live it to the destiny. But there's been many, many patients, and obviously we have many success stories. Seen many patients who have multiple abortions, and after everything, they have delivered a healthy baby. So I always tell them, please go through and check our inspiration fertility stories. So you get inspiration from them and keep a positive attitude in your life.
Right, right. Thank you. Thank you so much, Aditi. This was really motivating. I'm sure all the mothers who are watching today, they are on a show. Maybe later when they are seeing this show, they'll feel more motivated. And on the very positive note, definitely, if everything has two sides, if something has come on a pain side, please ignore that negative part and move ahead. There's always that another side.
Absolutely. Absolutely. Thank you so much, Nisha, for inviting me. And it was my pleasure to talk on such a less spoken topic. And I hope even 1%, hope I've given to patients who have suffered from miscarriage. It has made my day and it has solved our purpose.
Definitely,
So,
Aditi.
all the viewers, we're always available. Any problem, any difficulty you're facing, you can always reach out to us. And as soon as you get pregnant, whosoever your gynecologist is, you can reach out to them and get treated as soon as possible, as soon as the pregnancy test is positive. That's my take home message.
Thank you. Thank you so much, Aditi, for giving us your time.
Yeah.
Thank you so much, all
Okay.
mothers, for joining us today.
My pleasure.
Thank you, dear.
Thank you, everyone.
Okay.